Hello, and welcome to the official training guide for the use of the multifunction cardiogram. We are very happy to introduce this wonderful machine and walk you through how to use it step by step. Straight out of the box, you will have the MCG field unit itself, a power cord, the ECG cable along with a set of clamps color-coded to match each individual wire, a set of single-use electrodes, and the quick testing guide. Firstly, plug your device into the nearest power outlet. After that, connect the ECG cable to the device as shown on screen here. First, we must turn the MCG system on. For help locating the power switch, refer to your device's technical manual for your particular model. If the device has been off for more than an hour, give it at least 10 minutes to warm up before testing. And then tell the patient to rest on their back for 5 to 10 minutes. The system performs at its best between a resting heartbeat of 60 to 70 beats per minute. Afterwards, tightly secure each colored limb clamp to their respective wire. This also goes for the V5 chest lead. Then, lay the ECG cable yoke as seen on screen here between the patient's legs and fan out the wires to their respective limbs. Use alcohol pads to clean the clamps and the patient's skin at the attachment points and shave excess body hair if necessary. The limb leads should be placed on the patient's inner wrists approximately 2 fingers breadth above the distal radial crease, and on the inner ankles, as seen here, approximately 2 fingers breadth above the inner malleolus. The chest lead should be placed where the lower left breast meets the chest wall in the V5 position, which is located at the 5th intercostal space along the anterior axillary line as seen here. If this is your first time testing this patient, you will need to create a new patient profile for them. In order to do this, select Create a Patient, which will open up the wizard. All text fields highlighted in pink must be filled out. First, enter the patient's last name, though it is recommended to also include the first. On the next screen, you will be required to enter the patient's sex and their date of birth. It is also recommended to provide blood type, height, and weight, though they are not necessarily required. Next, you are asked to provide additional identifiers, which is not required, but if the information is available, double-click the identifier, fill in the info, and hit Next. For this part, the device asks which doctor the test is being done for, but for now, simply select the user performing the test. And on this final screen, you can review the inputted data, correct any potential mistakes, or otherwise just click Finish, and you're done. Once the patient is adequately prepared and their information is registered within the system, we can begin testing. First, we will select Test a Patient to open its wizard. This screen is an overview of the field unit's function itself. In the next screen, we will be given a list of patients logged into the system. Find your patient, click their name to highlight it, and then click Next. This screen provides an overview of the patient's information for last-minute adjustment. And this provides an image of proper lead placement, giving us a chance to double-check the connections before proceeding. This is the testing screen, which automatically displays a live tracing, allowing you to adjust the leads to ensure good quality before recording. The two most important parts of this screen are the blue right-facing triangle button, which begins sample recording, and the colored circle adjacent to it, which switches between green, yellow, and red. This is an automated quality checker, red being unacceptable or poor, yellow being acceptable or marginal, and green for good quality. These are to help troubleshoot, but you must determine tracing quality yourself. Once the tracing is adequate, begin recording. The machine will take 3 82-second long samples. If the patient moves, speaks, or otherwise interrupts the recording, hit the stop button to cancel the sample and check the clamps and tracing while the patient has time to relax before hitting the record button once more. After the recording is complete, hit Next to go to the final page. This page allows you to review individual recordings for quality issues by double-clicking each sample and select which ones we wish to send in for analysis. For the greatest amount of accuracy, Premier Heart recommends sending at least 4 good quality samples. Once everything is to your satisfaction, hit Finish, and that will be the end of the examination. The patient is now free to stand up, and you will be able to review the results within a few minutes. A supplementary video on how to use the Premier Heart web app for test result viewing is also available.